talazoparib is in a class of drugs called PARP inhibitors, which is approved for metastatic castration-resistant prostate cancer in combination with a hormonal drug called enzalutamide for patients with defects in the DNA damage repair response. Data from labs at Dana-Farber, including Dr. Miles Brown's lab and Dr. Misha Beltran's labs, suggest that actually combining a PARP inhibitor with an inhibitor of a molecule called EZH2 might allow this DNA damage repair targeting strategy to work even in patients who don't have mutations in genes that would predict for a defect in the DNA damage repair response. And so we submitted a proposal for funding of this combination with the PARP inhibitor talazoparib with the EZH2 inhibitor tazemetostat that was funded through a Prostate Cancer Foundation Pfizer Global Challenge Award. In the Part 1A of the study, we defined the recommended dose for expansion at talazoparib 0.75 milligrams daily, which is about 75% of the approved dose in monotherapy, with tazemetostat at 800 milligrams twice daily. So that was what was used for expansion for 20 additional patients. So we had 27 total patients who were treated at this dose, where we were able to assess for clinical outcomes. And so what we concluded was that in this heavily pretreated and biomarker unselected population, this combination of the two drugs was associated with expected suppression of the bone marrow, but otherwise acceptable safety profile. And the clinical benefit was seen in a minority of patients. So what we're doing now in studies that are funded through the National Cancer Institute, through their SPORE mechanism, is to look for biomarkers in the pretreatment and on-treatment biopsy specimens and blood collections to really try to identify the subset of patients who really experience favorable outcomes with this particular regimen to then potentially test in the future.